10.
If we don't protect them, we are not protecting the communities that surround them.
Families with loved ones in prison have been asking when inmates will be vaccinated. Now we're getting answers. Good evening, I'm Paul Cicchini.
And I'm Jessica Coons. The State Department of Public Health is breaking down its vaccination plan. WCI3's Jen Last joins us now. So Jen, what have you learned about this rollout?
Jessica, the first phase of vaccinations in Illinois is broken into 3 tiers. At the top of the priority list, we have healthcare workers, long-term care residents, and staff. Then you have Tier 1B, which will include people ages 75 and older, frontline essential workers, sheltered populations, people who are homeless, and inmates. After that, Tier 1C with people ages 16 to 59 who have high-risk medical conditions, people ages 65 to 74, and other essential workers. Advocates for those behind bars say this news is encouraging.
It makes absolutely no sense to vaccinate correctional officers without vaccinating incarcerated populations and vice versa.
That's why Rebecca Ginsburg, a leader of the Education Justice Project, is relieved to hear inmates are in the second tier for vaccinations. To date, 747 inmates have tested positive for the virus at the Danville Correctional Center. Of those, 266 are still sick, and one man in his 40s died the day after Christmas.
I'm without words.
It's the first death reported at Danville. A former inmate tells us his friends who are still in prison say the news scares them and tensions are rising. More than 60 inmates across IDOC prisons have died from COVID-19 since the start of the pandemic. Ginsburg says the sooner everyone, that means staff and inmates, are vaccinated, the better.
I understand that some people are grappling with the moral justness of protecting people who have been convicted of harming others and of causing violence to others. And I appreciate that these are deep and complex moral issues.
Travana House says personally she's nervous about the vaccine.
But I do think and appreciate the fact that they are thinking about putting them in the next round of vaccines.
She says inmates will need to be educated on the vaccine's benefits.
So if they feel like it's really going to work and it's really something good for everyone and it's working for other people, then they need to go and encourage and educate them. Because nobody's going to take any medicine without any education behind it.
And one other concern we've heard about repeatedly from former inmates and their loved ones on the outside, including Travana, who is the girlfriend of one of the inmates, is that cleaning supplies are too watered down. I tried asking IDOC about that last week to no response. Today, they got back to me saying DOC facilities use a bleach solution recommended by the CDC and that there is no shortage at Danville, adding, quote, all men at the facility have access to disinfectants, bleach solution, and other cleaning materials. Back to you.
All right.